my presentation, this will be talking to yourself about is to engage tribes in a successful way. You should really have tribal staff, like my position. It's pretty hard to work with tribes when you don't have tribal people on your staff. Some of our culture, some of our history, that will really help in the partnership, because every tribe has a unique history. Every tribe has unique, and we have counterparts within the tribal governments, Indian Health Service, urban programs, intertribal council. To be successful, you really need to know your counterparts and how to engage them. Next slide, please. And like the title of the session, A Matter of Trust. I'm going to be talking a lot more. When I was talking to Patrick and Shavir, I told them that you just can't take out medical and just talk about medical mistrust when you start talking about tribal people. We had 500 years of mistrust, distrust. And I'm going to share some of that and how that's impacting our health today. And really, in order to work successfully with tribes, you really should seek their input before the fact. So too many times I've seen health departments and other groups write grants and then afterwards trying to include the tribes, you know, and just run into all kinds of problems. And like every the group, you got to keep communications going on a regular basis, build coalitions. And if you're thinking short term, you'll never build the partnerships. Like anybody else, it's a long-term commitment if you want to be successful. Next slide. So we all have our tribal languages. And so I'm going to introduce myself. And then I'll explain what I said now. Yeah, kwasana. Hey, denishla. They touch in isla. Nakadna bashes chain. Dash a che ma dash kishni. Dash a che ma dash kishni. I see Ani Nezda Nasha. Eight out the Nashla. So what I said is, my blood, we are a matriarchal community. So we take our mother's clan. So we have 4 mother clans. And so my clan is my mother's clan, Oje Tachini. My father's clan is Nakaidna. My maternal grandfather's clan is Ma'adashkijni. My paternal grandfather clan is Senajini. Clans are very important. Their bloodline is very important. For instance, if there's a Oze Tachini in the audience, that person would be my brother. And I would refer to him in the Navajo language as my brother. If he's older, he would be my older brother. And if he's younger, of course, my younger brother. Same way with the sister. So greetings and respect for the bloodline is very important in the indigenous cultures. Next slide, please. And my position was created in 2001, 100% funded by the state. I'm a one-person office, and I report to the assistant director of the department. Next slide, please. Might be a communication link between the tribes and the state of Arizona. The tribes expect me to advocate for their issues. I'm the voice within the state health department. Later on, I'll be talking about tribal consultation. I'm responsible for the compliance. Native American representative for the department. Because of our history, it's still the case where Indian tribes really don't know what the states are doing, and the states really don't know what the tribes are doing. So, bringing parties together and trying to have win-win situations. Next slide, please. Within Arizona, my constituency are the 21 tribal health departments and offices, what's called urban Indian health programs, which I'll explain later, and the Indian Health Service, which I'll explain later, and the Intertribal Council of Arizona, which I'll explain later. Now, basically what I'm covering, though it's very specific to Arizona, all the tribes, all the states are very similar in terms of organization. So I did want to state also that I'm going to talk a lot about my own tribe, state of Arizona. But I know everybody's different. Every geographical area is different. What I might say may not necessarily directly apply to other states, but generally they would. Next slide, please. I never want to give a presentation and talk about Arizona without our tribes. So I won't go through all these names in the interest of time, but I want you to know who the tribes are. And sometimes there's multiple tribes that make up one tribe, because in history, originally they were separate tribes, but during the Indian Wars and the Indian reservations, the US government combined tribes together and formed one tribe, one reservation. Next slide, please. Again, some of our other tribes, the Havasupai tribe lives in the Grand Canyon. You can only reach them by horse, hiking, or if you have money, catch a helicopter. So people talk about remoteness. I don't think you can get more remote than living in the bottom of the Grand Canyon. And you can imagine how services can be provided. The Hopi Tribe is one of the oldest tribes continuous in one place without the United States for centuries. Navajo Nation is one of the bigger tribes. Next slide, please. Donna Autumn Nation, they used to be known as the Papago, given to them by the Spaniards. They referred it back to their own name. And they have 75 miles of contiguous border with Mexico. And they have tribal members in Mexico. Next slide, please. And here are the tribes in Arizona, scattered pretty much throughout the state. Got tribes bordering the Utah border, their New Mexico border, Colorado, Nevada border. We got tribes along the Colorado River. We've got tribes around Phoenix, around Tucson, and going east, the Apache tribes. Next slide, please. In Arizona, American Indian land is 29%. We make up 5% of the state. Because we have such a large land base, over half our people still live on the reservation. but a lot of our people live in the urban communities. And nationwide, that's just reversed. There are more American Indians now living in the cities than on the reservations. Next slide, please. These are health statistics that I wanted to just share because, again, these are for Arizona, but you go to any state and you have travel statistics, they'll be pretty familiar, pretty similar. We have the highest poverty rates, the lowest high school diplomas. Our teen pregnancy rate are a lot higher than the state average. And we have a lot of our people, 400% greater diabetes. We have one tribe that has the highest diabetes rates in the world. And this all happened after our people were put on reservations, and the lifestyle of our people was totally uprooted. And so we didn't have diabetes in our history. You can look at all these old American Indian pictures and you'll never see an obese native because we had to hunt, we had to farm, and we're healthy people. It wasn't until new diets were introduced to us and we were cut off from our traditional homelands and way of life, our ancestors. Next slide, please. Unintentional injuries, again, 300% greater than the other populations. Our reservations are real rural. We have a lot of long distance that our people have to travel. Unfortunately, we have a lot of our people that are still abusing alcohol, substance abuse, opioid, methamphetamine. So half of those situations are alcohol and substance related. Too many of our people are dying at a very young age. STD, chlamydia, again, our rates are a lot higher than the state rate. Again, that's just history. That's why I talk so much about history. You know, the culture of clashes, even though the Indian Wars ended 200 years ago, our people are still suffering from the trauma and just the current situation of just trying to live and maintain our culture within the greater society, which results in unsafe activities. Our people die at a medium age, 16 years younger than the average Arizona citizen. Our population is young, but that doesn't totally explain the wide, huge disparity of the age of death. Next slide, please. So for Arizona, these are the 5 leading causes of death. Again, unintentional injuries, cancer. I have a specific example on mistrust, distrust concerning Navajo miners, which I'll talk more about, diseases of the heart, chronic liver disease, cirrhosis, and diabetes. Next slide, please. And we do publications, and these data were from the 2015 data report that we did for American Indians, just highlighting. Next slide, please. Tribal sovereignty. When you start working with tribal people and tribal government, people are going to start talking about tribal sovereignty. And a lot of people don't understand what is meant by tribal sovereignty. So sovereignty is the God-given right to the Creator's people that he put on the various parts of the earth to govern themselves. So we're not governed throughout the world by one government. We're not one people. We're very diverse people. And so the same way with tribes. Before 1492 and Columbus and the 13 colonies, we were totally self-sustaining. We took care of our own people for thousands of years. We had our own form of government. We had our own form of health care. That's sovereignty. And so when we were defeated by the U.S. cavalry, our ancestors entered into treaties. And those treaties gave the rights for tribes to continue to operate. And we have nowhere near the time to talk about the whole history of the Indian people. And I'll cover some more later on. But basically, when the Europeans came into these lands, it was annihilation of the Indian people. And gradually over time, the policy changed that we have a God-given right to remain as a people. And through the treaties, we have sovereignty. We can enact our own laws subject to federal oversight. So our lands, our reservations are held in trust by the U.S. government. During various history, there was a lot of attempts by Congress to do away with the Indian people and to do away with treaties. And they passed all kinds of laws because we had no representation in Congress. So Congress could do anything they want. And one of the laws is 280, giving up federal responsibilities and transferring over to the states. So there are 8 states in the Union that have some jurisdiction over tribes, like California. Arizona is not a public 280 state. So our tribes still have a lot of sovereignty. Next slide, please. Again, what I was talking about. Before Columbus, historians say there was over in excess of 10 million American Indians, Alaskan Natives. In the early 1900s, that went way down to maybe 200,000. And we were actually referenced as the vanishing Americans. The thought was that we would disappear as a race of people. The 13 colonies were created. Our tribes in the East were forced to relocate back to the West. Indian wars, we had treaties, reservations. The Bureau of Indian Affairs was formed within the War Department. There was termination policies, again, to like Public Law 280. And then there was boarding schools to, well, let's go to the next slide. So these are historical quotes in our history. General Philip Sheridan, during a meeting with the Indian tribes in Oklahoma in 1869, this is his quote: "The only good Indian is a dead Indian." During the acculturation of the American Indian kids. The theme of the American government was kill the Indian and save the man. In other words, don't talk your language, don't practice your traditions, don't wear your traditional clothes. You are to become like the other citizens. So these were attempts to exterminate the indigenous people of these lands in the 1800s. Next slide, please. Medical distrust, mistrust. Navajo Nation uranium mining workers. During the Cold War, the United States Atomic Energy Commission opened up uranium mining in what they call the Colorado Plateau, New Mexico, Utah, Colorado, Arizona, 1948 to 1971. A lot of that was on Navajo land, Navajo reservation. The United States was the sole purchaser of those uranium. There was few protection for the miners before 1962. Next slide, please. The minority miners, including American Indians, were the least advantaged population with respect to workforce safety. The uranium had been mined for centuries in Germany. So they already knew there was a link with lung disease back in 1879. Next slide, please. But yet, there was no education given to the Navajo people of the unsafe condition of mining the uranium. And when the uranium finally ended mining, the mining companies walked away without sealing those tunnel openings. So today, there are thousands of unsealed tunnels, pits, radioactive waste remaining on the Navajo Nation, and still causing health issues for our people. Next slide. Out of 150 Navajo miners who worked at a uranium mine near Shiprock, 133 died of lung cancer, various forms of fibrosis, again, because they weren't told the danger of uranium mining when there was already proof years before that there was danger. But capitalism, the almighty dollar, took precedent over safety. Navajo people advocated with Congress and other people suffering the same consequences of uranium mining. Congress finally passed the Radiation Exposure Act in 1990. Next slide, please. So these are just the sources of where I got that data. Next slide, please. I wish I could go back to that other slide on the uranium of the 150 miners, but I won't. But a lot of my relatives, I'm from Shiprock. When I introduced myself in Navajo, I said I was from Shiprock. And many relatives, because my mother's home community was like the epicenter of the uranium that was mined. So I have many relatives that suffered and died too young. Because they weren't properly warned of the danger of mining the uranium ore. But I don't really want to get into it too much more. Next slide, please. Next slide, please. Okay, now, go back another slide. Okay, now I'm gonna start talking about the healthcare now. We have the Indian Health Service, created in 1955. We have two landmark congressional acts, Public Law 93-638 and 94-437. We have a heavy investment in an Affordable Care Act. So when people were talking about rescinding the Affordable Care Act, Indian people were very concerned because it would rescind a lot of work that the Indian people had put into that act that a lot of people do not understand. Next slide, please. Government to government relationship. So all that history that I covered that was negative, the pendulum started to swing back to try to preserve what little was left of the Indian culture and the Indian way of life, the Indian governments. So President Bill Clinton issued the first executive order to require all federal agencies to work with tribes on a government-to-government basis and to consult with tribes before enacting policies that would impact the tribes. Next slide, please. President Biden, well, first, all presidents since Bill Clinton sustained that executive order. President Trump did not do anything. President Biden, as one of his first action, sustained the executive order of President Clinton on January 26, 2021, very recent. Next slide, please. So, some of you that are working for the federal government, you'll be asked to provide data because all agencies have to submit a plan of tribal consultation to President Biden within 90 days of that executive order. They have to designate an official that is going to be the main contact with the American Indian people. Reports have to be submitted to the President, the White House, OMB. Annual progress reports are going to be required. Next slide, please. In Arizona, our former governor, Napolitano, issued an executive order in 2006 requiring tribal consultation. So all agencies reporting to the governor's office had to produce tribal consultation policies. And we at Arizona Department of Health Services did ours in 2006. And tribal consultation in Arizona became a law in 2016. Next slide, please. I love to talk about our tribal culture, and I have no time to talk more about it. But there was one healer in the meeting. There was a lot of PhDs and MDs in a meeting, and they were talking about their degrees and where they got them. And then a Navajo healer said, my degree is from the universe of Mother Earth. Which says a lot, you know, because in our healing system, our belief is what happens in the universe affects the earth. And what affects the earth affects us. We belong to the earth. We don't control the earth. And what you see in the picture is a sand painting. And you see how calm the medicine people are. How calm that picture is. And the patient would actually sit on that sand painting. And the ceremony would be performed. And I've went through several of these because as a Native person, I can be sick in the white non-Indian way, and I can be sick in my own indigenous way. And if I can't get well going to hospitals, I know I got to go back to my reservation and have a ceremony because I'm sick in the indigenous Navajo way. And I'm grateful that we still have some healers that still know these ancient healing. And they all start with a prayer. You will never go to any non-Indian physician where that physician will start with a prayer. So big differences. And again, a lot of this was taken away from our ancestors through history, but some of our tribes are still hanging on to some of these healing. Next slide, please. The ITU system, the I stands for Indian Health Service, the T stands for tribes, the U stands for urban program. I know I'm quickly running out of time, so I want to speed it up here. Next slide, please. And the Indian Health Service is the U.S. government's federal agency responsible to honor the treaties. When our ancestors signed these treaties, we were education, welfare, and healthcare. We gave up all of the United States, basically. So we say that we were the first prepaid healthcare system. We already paid for this healthcare. And now there's different methods of how to deliver. And again, I won't spend too much time on this. Next slide, please.
And Michael, I just wanted to assure you, you're doing fine on time. So take as much time as you need, please.
Okay, thank you, Patrick. So the Indian Health Service is a department under the Department of Health and Human Resources. And they are geographically organized through 12 area offices throughout the United States. Next slide, please. Tribal health programs. Under Public Law 93-638, passed in 1975, tribes have the legal right to take over federal facilities, Indian Health Service. And a majority of Indian Health Service is now operated by tribes. Before 1974, our people had no ownership. We were just patients. Now we're owner operators. And again, because of history, our people were really stripped of resources to develop our own facilities. Next slide, please. Urban Indian health programs. Back in the back in 1956, there was a federal program. It was voluntarily to move Indian people off reservations into the cities because of employment and educational opportunities. Through Public Law 94-437, there was funding actually appropriated for the urban Indians, because you can go into any United States city and there's going to be a pocket of American Indians. And a lot of them got there through that relocation program. So there was some federal responsibility to care for urban Indians, not just on the reservation. And there are 41 urban Indian health programs throughout the nation, many of them in California. And they're 501c3 nonprofits. So they can use the base dollars and then go after grants and contracts. Next slide, please. Tribal healthcare financing. You would think because we have the treaties and their legal obligations, our funding should be mandatory, entitlement, but it's discretionary. So every year, our Indian leaders have to go to Congress and negotiate and advocate for funding. And right now, we get 50% of what's needed. And at least our facilities are eligible to get reimbursements from Medicaid and third party. And then we have something called 100% FMAP, which I don't really have time to get into, but it's in a business term, it's like a competitive advantage. Next slide, please. Okay, now let's talk about partnerships. What are we doing in Arizona? The Arizona Department of Health Services. Whenever we can, we contract directly with the tribes. And because they're because they're governmental entities, we don't have to go through the procurement process. We can contract directly with the tribes. We have data sharing agreements. We have to do unique collaborations. Like for Medicaid, if there's a private provider on a reservation, they can't use their Medicaid license off reservation for on reservation. So we had to work out a system, which we did, so that we could do what's called a courtesy survey in lieu of state licensing, because the states have no jurisdiction on the tribes. But these states, these entities, if they wish to be reimbursed for services, they have to have a state license. And so we worked out a system with 3 tribes. Very unique. It took tribal council, 2 state agencies, the Center for Medicaid and Medicaid Services to negotiate these arrangements. Next slide, please. Our Arizona State Hospital, you have to have court orders through the counties. So we worked out a system where tribal court orders can be recognized and domesticated through county superior courts, so that we can admit tribal people involuntarily into the state mental health hospitals. We do multiple conferences, summits, forums, workshop, work groups. Next slide, please. In 2018, we initiated a statewide Arizona Tribal STD HIV Hep C conference. We put together a statewide tribal Indian Health Service urban program state agency planning committee. And we had over 250 participants for every session, every conference. Well accepted. We also sponsored opioid substance use conferences in 2019, 2021. Same planning process, same result. A lot of good participation. And this is the way we start getting people together. to start to know one another. If you don't know one another, how can you work together? Next slide, please. In 2012, we put on a health conference to help our Indian students go into the health profession. Some of you may know about what's called the AHECS, Arizona Health Education Center. By law in Arizona, there could only be 5. So right now, we have legislation to create a 6th center that will work exclusively with our American Indian people. So we not only help on congressional, we also help on state legislation in terms of our partnerships. Next slide, please. So here's just some guidance for people who wanted to work with tribes. Tribes are sovereign nations. Indian cultures are alive and well. Tribal governments already have programs. Build on those programs. And tribal governments are nation building, trying to rebuild what we used to have when we were independent nations. Next slide, please. The U.S. Commission on Civil Rights, everything I've just said in volumes and volumes of paperwork and hearings, documented everything I just covered in 2 documents, in 2003 and 2014. Next slide, please. And here's my contact. I do maintain a Native American website. And that's my contact information. I'll just leave you with another Navajo word, and it's ahaha, which means thank you. So that ends my my presentation. Again, thank you very much for your participation in this, the California Prevention Training Center, and other funding sources. Hopefully the information was helpful and would help you in terms of outreach with our American Indian populations, both in the cities and on our different Indian reservations. So we can go into questions and answers. And I know there's like maybe 4 questions in the chat box.
We actually haven't had any folks in the chat box put any questions in. But I really first just want to thank you for a very informative presentation, especially on the history and some places where we can really learn about where mistrust has taken place and what we can do to help to know that for ourselves, but also to help think about strategies when working with tribal communities.